There is an analgesia system. Now let me tell you, what is analgesia system within our brain? You know, within our central nervous system, there are mechanisms to reduce the pain. Is that right? Let me tell you how. This must be third ventricle. These are your thalami, isn't it? And of course, you know what is this? Cerebral aqueduct, midbrain, pons, medulla, spinal cord. Is that right? Now, this diagram must be really clear because this is clinically relevant with you. Actually, they have seen that periventricular, this is ventricle, periventricular gray matter and periaqueductal gray matter and some other midline nuclei like nucleus raphe, all of them have very special neurons which are coming down. These are coming down. These are descending pathways. What are these? Descending pathways. And they came to know that these pathways can release some neurotransmitter here which will block the pain transmission or inhibit the pain transmission. It means there are brakes applied to the pain system from the top. Gating theory was saying that any pathway which is going from here to here, that may inhibit the pain. But this is descending analgesic system. And you know what they found here? What these neurons are releasing? They are releasing something like morphine. As morphine is a painkiller, that something like morphine is called enkephalins and endorphins. What are they called? Enkephalins and endorphins. So enkephalins and endorphins are released by the descending analgesic system and it reduces the pain significantly. Is that right? Pain is really not as simple that you get a stimulus and get a pain. Pain is a strong emotional component with it. Is that right? For example, you fall down by your own fault and you get injury here, you feel pain. But if someone slaps here, pain will be less or more? More, with the big emotional component. Is that right? So actually pain is modified in many ways within the central nervous system and its intensity is unduly increased or its intensity is unduly decreased. Is that right? So its intensity can be decreased by these descending analgesic fibers which are coming from periventricular area, periaqueductal gray matter area and other midline nuclei from the brainstem. Is that right? And that can release here endorphins and enkephalins. If you have done something great, worthwhile, and during that you get injuries, I think pain will be less painful. This system is working happily. Is that right? But if someone really beat you and insult you, the pain will be less or more? The pain will be more painful, isn't it? And probably the system may not work well. Is that right? So what I'm talking about, that within the pain is a stimulus which is not so simple like touch. It has a heavy emotional component with it. Even touch may have emotional component, right? But pain always has a heavy emotional component and usually a negative one. Why it is so important to mention? Because you are going to manage the patients, right? And a patient who has pain and you don't explain the disease well and patient becomes too anxious, his pain will be more. When doctor is compassionate, when they say the doctor touches, half of the disease is reduced, it is really reduced. At least pain is reduced. Because emotional component, patient feel assured. When doctor has time to talk, he is compassionate, right? Even there is a cancer pain, that will be reduced to some extent. Patient's own endorphins will be there. So pain you have to learn at 3 levels. Number 1, pain transmission. Pain transmission. Number 2, pain perception. Number 3 level is pain modification. rather modulation. The right word is modulation. Let me tell you. Pain transmission means that you talk about the source of pain, chemical substances producing pain, free nerve endings, type of the fibers, central connections, and how they are connected. All this is pain transmission. Then pain perception, right? One occasion, by your own mistake, you get injury here, and at another occasion, someone slaps you, and the same degree of injury is there. But first pain will be you will be more disturbed by first pain or by the second pain? By the second pain. Why? In both pains, transmission system was the same, but perception was altered at emotional level. For example, your friend is going under, he is suppose fallen in some tragic situation, and you jump and bring him out and save his life, and you get severe injury, but you really save the life of your friend. Do you think it would be very painful or less painful? Less painful. But if you are fighting for your life and someone is kicking you down into a dangerous hole, the pain will be too bad. Is that right? So whenever we talk about the pain, good doctor should know, number one, transmission of the pain, right? Number two, perception of the pain. And number three, modulation of the pain, because we need to modulate the pain. You can affect the pain by many ways. But two important things which I discussed, gating theory here and descending analgesic system there. Do you have any question related with the pain transmission? Yes? Do you have any question related with the pain transmission? No. And you have also, now you are very clear about the lateral spinothalamic tract as well as anterior spinothalamic tract. Is that right? Anterior spinothalamic tract is taking which sensation up? Yes, please. Crude touch. Lateral spinothalamic tract is taking which sensations up? Pain and temperature. Is that right? Both tracts meet with the tectospinal tract and medulla and make which lemniscus? Spinal lemniscus. Spinal lemniscus is specially connected at the top where? Ventroposterolateral nucleus of thalamus, right? From their pain fibers, from ventroposterolateral nucleus, they go upward, especially in postcentral gyrus. For which purpose? For analysis of the pain. And fibers also go to cingulate gyrus. For which purpose? Emotional reaction to pain. Fibers also go to insular cortex for autonomic reaction with the pain. Is that right? Then a very good student should know the slow pain pathways, especially as they are going upward, especially connected with reticular formation, which alerts all the central nervous system. Plus, slow pain pathways in the thalamus are heavily connected with which nuclei? Intralaminar nuclei. They also stimulate the all cerebral cortex so that you don't ignore the pain. You have to do something because your tissue is being destroyed. Is that right? So let's have a break. Right, so we were talking about the ascending tracts. Up to now, we have discussed the dorsal column lemniscal system and anterolateral system, right? Actually, dorsal column lemniscal system and anterolateral system, both of them are connecting the sensations entering into spinal cord with the thalamus and eventually to the cerebral cortex, because all of them are taking sensations up to the cerebral cortex. So sensations passing through dorsal column system and through the anterolateral system, they reach to your conscious level. Is that right? Any information which goes to cerebral cortex will be reaching to your conscious level. But actually, there is a lot more sensory information which has to be delivered to the cerebellum, right? Especially about the position of the joints, tension in the ligaments, muscles, joint capsules, tension within the muscles, right? All this information from the locomotor system must go very, very rapidly to the cerebellum also, so that cerebellum can plan the movements and posture appropriately. Is that right? Now, those pathways which take the information from the spinal cord, right? Those pathways which take the information from the spinal cord up to the cerebellum, those pathways are called spinocerebellar pathway. What are they called? Spinocerebellar pathway, right? The important point about those pathways is that they are connected with ipsilateral cerebellum. What I mean, that information from right half of the body will be directly or indirectly reaching to the right cerebellum. Is that right? So information from the spinal cord which is going to the cerebellum is directly or indirectly going to the ipsilateral cerebellum. But you have to remember that information through the dorsal column lemniscal system and information through anterolateral system, that is connected with the contralateral cerebrum, right? So now let's discuss into detail spinocerebellar pathways. Let's suppose that here is your spinal cord, and again actually there are two main spinocerebellar pathway. One spinocerebellar pathway which I'm going to show you now is called dorsal spinocerebellar pathway. The information which is coming is from Golgi tendon organs, from muscle spindles, and from pressure receptors, right? And this information, right, these fibers turn medially, okay, these fibers rather in dorsal horn they terminate, and from their second order neurons move ipsilaterally on the right white column, right, or you can say lateral column. Once they come into lateral column, from here the information will ascend upward. Is that right? And from contralateral side also, right, first order neurons will terminate at the gray horn at the entrance, and from here second order neurons give connections which are going to the lateral horn and then going upward, right? Now these cell bodies, they are making a nucleus throughout in the spinal cord. What I mean by this, that if I draw spinal cord like this, then these, because at every point through the spinal nerves, information is coming, so these are the cell bodies and they are present bilaterally and they are making a vertical nucleus. This vertical nucleus is called dorsolateral nucleus of, yes, who knows, Clark, or simply called it Clark's nucleus. So actually we say that for spinocerebellar pathway, this is going to be posterior spinocerebellar pathway, right? So in fibers, first order neurons have their cell bodies in dorsal root ganglion, the central connections enter into dorsal gray horn, from there they terminate on which nucleus? Clark's nucleus. From there second order neurons, cell bodies, give the axons which move ipsilateral to the lateral white column, and from there they move straight upward. Is that clear to everyone? Now let's see what happens up. Here is, what is this? Medulla. Here is pons, and here is midbrains. And what is here? Cerebellum. Is that right? Now one point which is very important to understand, these are special white bundles which are connecting the brainstem with the cerebellum, and medulla is connected to the cerebellum through which, what is this connection called? Inferior cerebellar peduncle. What is it called? Inferior cerebellar peduncle. Pons is connected to the cerebellum through middle cerebellar peduncle, and midbrain is connected to the cerebellum through superior cerebellar peduncle. Am I clear? Right? In a side view, if I want to show, it will be like this: brainstem, pons, medulla, and spinal cord, and here is cerebellum. So this must be superior cerebellar peduncle. What is this? Middle cerebellar peduncle and inferior cerebellar peduncle. What are cerebellar peduncles? These are bundles of white matter which connect the brainstem with the cerebellum. Am I clear? Now, thank God this pathway is so simple that these fibers will go upward, and through inferior cerebellar peduncle they will be connected with the cerebellar cortex. That's it. and because it is on the posterior side of the lateral white column, so this is called posterior or dorsal spinocerebellar pathway. What is this? Posterior or dorsal spinocerebellar tract. Is that right? First order neurons are where? In the dorsal root ganglion, first order neurons. Especially they are present from C8 in the spinal cord. These are the dorsal root ganglion, right? Like this. Now it starts from C8 up to S3. All these fibers are entering in, right? But Clark's nucleus, the Clark's nucleus that extend from C8 to L3. Clark nucleus extend from C8 to L3, lumbar 3. It does not go at lower lumbar and sacral level. So all these fibers which are going to the Clark nucleus, you are understanding it, right? Lower fibers have to ascend upward. Clark nucleus does not, it extend from C8 up to lumbar 2 or 3 level. But the fibers which are entering for dorsal column, they are entering from dorsal root ganglia of C8 to not L3 but L4, L5, S1, S2, S3. So fibers which are entering to lower level where Clark's nucleus is not there, fibers ascend upward and get connected with the Clark nucleus. Then from the Clark nucleus, fibers start going upward and then eventually to cerebellum. Am I really clear? No problem into this, right? So you see that right side of the body is connected with the right cerebellum and left side of the body is connected with the left cerebellum. This is called dorsal spinocerebellar tract, right? Now, actually, there is a very interesting pathway, but at higher level. The dorsal root ganglion give fibers which come into, okay, at a higher, suppose it started from here, C8. Is that right? And superior to that, still many fibers are entering. Dorsal root ganglia are there, C7, C6, C5. You are understanding it? All those fibers also enter, right? They pass through a similar pathway. And what was this nucleus? Clark's. Is that right? But here there is another extra nucleus in which especially from upper limb information is coming. Clark nucleus is receiving the information from lower part of the body, right, from the trunk and the lower limbs. Is that right? But this nucleus is receiving information from upper. And then these fibers also give fibers and they go upward with this. Now, this is Clark's nucleus. This is given a very different name. This is called accessory cuneate nucleus. So don't confuse accessory cuneate nucleus with the nucleus cuneatus, because nucleus cuneatus was in the medulla somewhere here. You remember? Nucleus cuneatus and gracilis. These are gracilis, cuneatus, cuneatus. And you remember they were making which fibers? Internal arcuate fiber, and then they were going upward as medial lemniscus. And there's no fun in telling that their fibers were coming from fasciculus gracilis and fasciculus cuneatus, right? Because actually this nucleus was extending up to the original cuneate, and then fibers were arcing like this. So somehow doctors were surprised. They thought probably these fibers and these fibers are related. Later on they discovered functionally they are not related. These are dorsal column lemniscal system and this is spinocerebellar system. Is that right? This special spinocerebellar system coming from the upper limb and neck, right? This is called cuneocerebellar pathway. Cuneocerebellar pathway. So to remember it easy in your mind, you can say cuneocerebellar pathway is the counterpart of dorsal spinocerebellar pathway, but from the upper limbs. Is that clear? In dorsal spinocerebellar pathway, the nucleus is Clark. In cuneo-cerebellar pathway, nucleus is accessory nucleus of cuneate system. In dorsal spinocerebellar pathway, this is the right, information is coming from lower limbs and trunk. But in cuneo-cerebellar pathway, information is coming from upper limbs or arms. Don't say upper arms. Is that right? Am I clear? Right. If these are clear, I will tell you another pathway. That is very different, but very interesting. That I should call that naughty pathway. You see, there is really very naughty and jumps around. There is another pathway which are coming, fibers are coming from, again, from Golgi tendon organs, coming from muscle, spindles, and coming from pressure receptors, right? And these fibers enter and end up into, on the second order neurons within the spinal cord, right? End up within the spinal cord. From here, these fibers move, okay, they move contralaterally and move upward. Now, and from opposite side, also fiber come here. They are also connected, what? Contralaterally. And from here they are going up. Now, these pathways are actually making anterior spinocerebellar pathway because they are anterior to those red system. Is that right? Now, the special thing is anterior spinocerebellar pathway, the second order neurons cross, but actually they are supposed to be connected on the same side. So what they will do? After the crossing, they are naughty. They were not supposed to cross, but they did the crossing because information from the left side must go to the left cerebellum, but here it has crossed to the right. Information from the right spinal cord, right side of the body, must go to the right cerebellum, but again it is crossed. After having crossed, they go really very much up. They don't enter into inferior cerebellar peduncle, they don't enter into middle cerebellar peduncle. They enter into superior cerebellar peduncles. Through that they go to cerebellum. Then from there they again turn back, and behind that they come to this side, they recross. Basic principle is same. Same side of the body with the same cerebellum. Is that right? Because they wrongly crossed down, so they have to recross at the top. Is it really difficult to understand? Right? Now, so this pathway is called, which pathway? Ventral spinocerebellar pathway, which is a crossed pathway. But it recrosses within the cerebellum. Is that right? Or we call it anterior spinocerebellar pathway. Okay, all these pathways are really learned well. Let's do a practice now. Alright? Listen. Attention please. Now let's suppose I'm the spinal cord. I will by my hands, I will show you there are some components of dorsal lemniscal system, some components of anterolateral system, and some component of spinocerebellar, and you have to recognize. Fibers are coming in the spinal cord. They don't terminate there. They go backward through the dorsal column, they start moving upward. They will terminate in some two nuclei. From there they will cross, and then they will go up into thalamus, and then eventually to the cerebral cortex. What was this pathway? Dorsal lemniscal system. But you have to tell me the components now. Fibers entering through dorsal root ganglion, moving backward from lower part of the body into which fasciculus they are going up? Fasciculus gracilis, and from upper part of the body they will go up through fasciculus cuneatus. Then nuclei in the lower medulla. Which nuclei in the middle? Gracilis. On the sides, cuneate. What are these fibers? Internal arcuate. What are these? Medial lemniscus. This go up. What is this connected to? Which part of the thalamus? Ventroposterolateral. Right? Once they are connected to ventroposterolateral, they pass through which capsule? Internal capsule. And then they fan out and connect it to cerebral cortex. Precentral, post-central gyrus. Clear? Now we recognize another system. Fibers enter, terminate at the level. Right? While termination, ascending and descending branches. Root tract is being made. Lesser. And then second order neurons cross to the opposite white column. What we are making? Lateral spinothalamic tract going upward. Which information it is taking? Lateral pain and temperature. Another group of fibers is also coming. They terminate at entry and second order neurons cross to the anterior area and then go upward. What are these? Yeah? Crude touch. What is this pathway? Anterior spinothalamic. Is that right? Now lateral spinothalamic as well as anterior spinothalamic will meet with spinotactal pathway at what level? In medulla, pons or midbrain? In medulla. And they will make which lemniscus? Spinal. And spinal lemniscus will go up to what? Again ventro-posterolateral nucleus. So actually dorsal column system, dorsal column medial lemniscal system and anterolateral system both converge at ventro-posterolateral nucleus of thalamus. Above that their pathway is similar. Is that right? Pain pathway specially connected with the reticular formation. Why? To alert the brain. Pain pathway is specially connected with intralaminar nuclei of the thalamus. For what? Again to alert the brain, cerebral cortex. Pain pathway not only connected with post-central gyrus but also connected with insular cortex. For which purpose? Autonomic responses. Pain pathway is specially connected with the cingulate gyrus. For which purpose? Emotional responses to pain. Is that clear? Now you recognize this pathway. You have to be rapid. Information come, second order neurons at the entry point greet the information, take it up through the inferior cerebral peduncle, go to cerebellum. What is this? Yeah? Which spinocerebellar tract? Dorsal spinocerebellar tract. Now listen. Fibers come, terminate at entry, second order neuron cross, go up through the superior cerebral peduncle, they go to cerebellum, within the cerebellum cross back. Ventral spinocerebellar pathway. Is there any difficulty? Is there any difficulty? Now I will rapidly make it and you have to tell me what pathway I have done. No talk, just name the pathway. Dorsal lemniscal pathway. Okay. Pathway has entered. Anterolateral system. It entered and it connected there. This and crossed. Look, the important point was dorsal column system moves upward in the spinal cord in uncrossed fashion and it crosses at lower medulla. Anterolateral system crosses at entry. Again listen. You have to recognize. What is this? Dorsal lemniscal system. Anterolateral system. Now you look at it. Spinocerebellar, which one? Dorsal. Anterior spinocerebellar. We have finished the major, all ascending tracts. There are few minor. 3 of them I will mention very briefly, only in 5 minutes. Just stop your watch. Now, we'll go to some 3 pathways I will mention. Okay, this is your cerebral hemisphere. Here it is midbrain, pons, medulla, spinal cord. I just make one section. Now look, the points which you have to understand, this is cerebral hemisphere. Of course, on the side there is cerebellum. This is inferior peduncle, middle peduncle and superior peduncle. Am I right? Now, what is happening? That fibers come and second order neurons from here at the level of entry move cross to the opposite side and then go upward. And while they are going upward, they are connected with tectum here. What is this crossed pathway? Spinotectal pathway. What is this? Spinotectal pathway. If you really want to know exact position of tectum, then this is the midbrain, pons, medulla and spinal cord. These are the swellings on the back of the midbrain, right? This is called tectum. And fibers were entering there, and from here fibers were connected with the tectum. That was a very simple pathway. This is called which pathway? Yes, please. Spinotectal pathway. But if you remember that in the medulla it is joined by lateral spinothalamic as well as anterior spinothalamic, so it become a part of spinal lemniscus. You remember that? Tectospinal pathway. That's enough about tectospinal pathway. There is another pathway. Information comes, right, through dorsal root ganglion and dorsal sensory root. Then second order neurons cross and they are going upward and they end up into olive. You know, there is olive. This is a gray mass of gray matter in where? Medulla oblongata. So in the olive. So this is spino-olivary pathway. First order neuron was in where? Dorsal root ganglion. Second order was in gray horn. Then second order neuron, the extension went to the contralateral white column, ascend upward as spino-olivary tract. What is this? Spino-olivary tract. And through this tract, from the olive, information goes to cerebellum. This is another pathway, an extra pathway to take the information from the body to the cerebellum. Of course, which information is going through spino-olivary pathway? The information is proprioception, touch, pressure. Is that right? Now, or sense of position. So it is pathway somewhat like functionally somewhat like spino-cerebellar pathway. Is that right? But actually, why it is called spino-olivary pathway? Because from spinal cord fibers go and terminate on the olive of the medulla, and from the medulla next order neurons from the olive of the medulla through the inferior cerebellar peduncle get connected to the cerebellum. Right? So tectospinal pathway was for which purpose? Visual reflexes. And olivospinal pathway is for proprioception. Right? Movement and posture. Right? So that information come here and cerebellum will compute information which is coming for utilization for movement and posture decisions. Is that right? Then there's one pathway. Fibers come here, they don't cross and simply go up. And what was this thing? And if pathway is going from spinal cord up to reticular formation, it is called spino-reticular pathway. This is simply to stimulate the reticular formation and stimulate the whole, increase the whole conscious level. Right? Now, after this discussion, we can say how many systems ascending tracts we have done. Let's classify the tracts. You already know what are tracts? Tracts are bundles of the axons, right, which are moving in central nervous system up and down. Is that right? Having common origin and common termination, and functionally they are one group of fibers. Tracts are, yes, ascending and descending tract. Descending tracts I will not mention because we will discuss in the next lecture. Now, ascending tracts can be divided into major tracts and, yes, minor tracts. In the major tract, tracts for the, yes, tracts taking information for cerebrum and tracts for cerebellum. Is that right? Now tracts for cerebrum, they were, yes, what was that system? Dorsal column, lemniscal system. And what was the other system? Yes, please. Anterolateral system. Especially in dorsal column lemniscal system, we had fasciculus gracilis and fasciculus cuneatus, and then what was there? Internal arcuate fibers, and that was going to medial, yes please, lemniscus, right? And then to ventro-posterolateral nucleus. In anterolateral system, you must be knowing what was there in anterolateral system. There was, yes, pain and temperature pathway, which was lateral spinothalamic tract. Is that right? And other was crude touch, which was anterior spinothalamic pathway. Both of them together plus tectospinal. Is that right? They make which lemniscus? Yes, all three of them. Anterior spinothalamic, lateral spinothalamic and tectospinal. They make what? Spinal, yes please, lemniscus. And that also connect with the ventro-posterolateral nucleus. And then going to, of course, corona, internal capsule, then corona radiata, and then post-central gyrus. Is it difficult? Right? So then we come to the cerebellum. Cerebellum has three systems rather. One was dorsal spinocerebellar pathway, and with that there was another pathway from upper limb, cuneo-cerebellar pathway, and then which crosses at spinal cord and recrosses in cerebellum. What was the third pathway? Yes? Ventral spinocerebellar pathway. So how many cerebellar? Three. That is dorsal posterior spinocerebellar and cuneo-cerebellar and anterior or ventral spinocerebellar. Any problem up to this? There is no. Then minor tracts. Minor tracts, we can mention there are three. There are many, but three are important. Tectospinal. It is for what? Yes. For visual reflexes. It is connecting spinal cord with the tectum of midbrain. Then there is olivospinal. Olivospinal is taking proprioception from the spinal cord to the cerebellum for movement and posture analysis later. And third was reticulospinal, from spinal cord to reticular formation, to producing alerting reaction to the cerebral cortex. Any question up to this? Right? I will have few questions and then we terminate the class. If I say that there is a pathway taking pain and temperature upward, what is the name of the pathway? If I say there is crude touch going up, crude touch, yes, anterior spinothalamic. If there is proprioception, sense of position going up, spinocerebellar pathway. What? Proprioception and sense of position going up. Then you have to ask me a question. Is it going to the conscious level or not conscious level? If it is conscious, then it is dorsal column system. If it is not conscious, then it is spinocerebellar pathway. Is that right? Because proprioception is going to the cerebellum as well as to the cerebrum. If I say there is a pathway which is connecting the spinal cord to reticular formation, what's the name of that? Spinoreticular. And pathway which is connecting spinal cord to the olive? I think it's too easy, isn't it? And if pathway connecting the spinal cord to the tectum? What is the function of spinotectal? What is the function of spinolibrary? Proprioception, information to cerebellum. What is the function of spinoreticular? Activating the reticular formation and cerebral cortex. Okay. I will tell some features of a system and you have to tell me which pathway is there. There's a pathway which heavily connected with reticular formation and intralaminar nuclei. There's a pathway, ascending system, which is heavily connected with the reticular formation as well as intralaminar nuclei of thalamus. And at the top, it is not only connected with postcentral gyrus, but this pathway is also connected with cingulate gyrus as well as insular cortex. What is this pathway? Pain pathway. This is pain pathway, of course, anterolateral system. Is that right? I think it's enough for today. Class dismissed. Welcome.